If you're doing keto and the scale will not move, the first question is simple. Are you seeing a normal plateau or a medical red flag? Most stalls are boring and fixable, but a few patterns deserve a real conversation with a clinician. The goal here is not to panic. It's to spot the situations where just try harder is the wrong advice. Keto changes water balance, appetite, and energy use, so weight loss is rarely linear. Still, your body gives clues when something deeper is going on. Think of this as a checklist for when to stop guessing. We'll cover what's normal, what's not, and what to bring to an appointment. You'll also hear specific symptoms that matter more than the number on the scale. If any of these fit you, it doesn't mean something is wrong with you. It means you deserve a clearer medical explanation and a safer plan. Moving to slide 2. First, let's define what not losing even means on keto. In the first 1 to 2 weeks, many people drop weight fast, mostly from water and glycogen. After that, it often slows to a steadier pace, and some weeks show no change at all. That can still be fat loss masked by water shifts, constipation, or soreness from exercise. A plateau is usually defined as no meaningful change for about 4 to 6 weeks, while you're consistent. Consistent means carbs are low enough for you, protein is adequate, and calories aren't quietly creeping up. It also means sleep and stress are not wildly different week to week. If you're only 2 weeks in, a stall is rarely a red flag. If you're 2 months in with careful tracking and nothing changes, that's when it's worth looking deeper. The timeline matters because it tells you whether to troubleshoot habits or investigate health factors. Moving to slide 3, one of the biggest reasons keto stops working is that ketosis doesn't automatically mean a calorie deficit. Keto can reduce appetite, but it can also make high-calorie foods easy to overdo. Nuts, cheese, cream, butter, and keto desserts are dense. If your portions drift up, fat loss can stall even with perfect carbs. Another issue is protein. Too little protein can reduce fullness and muscle maintenance. Too much isn't usually a problem for most people, but it can crowd out other nutrients and make meals harder to manage. Alcohol is another quiet factor, because your body tends to prioritize metabolizing it. And then there's keto creep, hidden carbs in sauces, drinks, and packaged foods. If you haven't checked portions and ingredients in a while, do that first. But if you are tracking carefully and the stall persists, that's when the red flag section becomes important. Moving to slide 4. Now the first true red flag, rapid, unintentional weight change in either direction, especially with feeling unwell. If you're not losing weight, but you're also suddenly gaining quickly, that can be fluid retention rather than fat. Fluid retention can show up as tight rings, puffy ankles, or a sudden jump over a few days. On keto, some people lose water early, so later water regain can look like failure, even when food hasn't changed. But persistent swelling, shortness of breath, chest discomfort, or severe fatigue should not be self-managed. Those symptoms can relate to heart, kidney, liver, or medication effects, and they need clinical assessment. Another red flag is dizziness with fainting, confusion, or a racing heartbeat. Keto can change electrolytes, but severe symptoms are not a normal adjustment. The key is speed and severity. Quick shifts plus systemic symptoms deserve medical attention, not more restriction. Moving to slide 5. If you're doing keto correctly and your weight won't budge, thyroid function is one of the most common medical topics to discuss. An underactive thyroid can lower energy expenditure and change fluid balance. The clues are not just weight. Think persistent cold intolerance, dry skin, constipation, hair thinning, or a noticeably lower heart rate. Another clue is fatigue that doesn't match your sleep. Keto can reduce inflammation for some people, but it doesn't override thyroid hormone needs. If you've had thyroid disease before, pregnancy, autoimmune conditions, or a strong family history, it's even more relevant. A clinician may consider labs like TSH and free T4, and sometimes additional markers depending on context. Don't self-diagnose based on one symptom. The point is pattern recognition. If you have a cluster of classic thyroid symptoms plus a stubborn plateau, that's a reasonable red flag to bring up rather than endlessly cutting calories. Moving to slide 6. Another red flag category is blood sugar and insulin issues. Keto often lowers glucose, but if you have diabetes or prediabetes, your response can be complex. If you're not losing weight and you're also extremely thirsty, urinating a lot, waking up to pee, or having blurry vision, those are symptoms to discuss. Unexplained fatigue and frequent infections can also fit. On the other side, if you're taking glucose-lowering medications, not eating carbs can increase the risk of low blood sugar episodes for some people. Signs can include shakiness, sweating, irritability, or feeling suddenly weak. This is not about fear. It's about making sure your plan matches your metabolism and your prescriptions. A clinician might look at fasting glucose, A1C, and sometimes fasting insulin or other markers based on your history. If blood sugar symptoms are present, don't treat the plateau as a willpower problem. Moving to slide 7. For many women, a stubborn keto plateau is really a hormone and cycle story. Polycystic ovary syndrome, or PCOS, is a common example. It often involves insulin resistance, irregular cycles, acne, and increased hair growth in places you don't want it. Weight loss can be slower, and the strategy may need to focus on steady protein, resistance training, and sleep, not just carbs. Another situation is perimenopause and menopause. Shifts in estrogen can change where fat is stored and how your body handles stress. If your weight isn't changing and you also have cycle changes, hot flashes, new sleep disruption, or mood swings, that's worth discussing. Also mention if you recently stopped hormonal contraception or changed it, because that can affect water retention and appetite. A clinician can help rule out thyroid issues, anemia, and other causes that mimic hormone problems. The red flag here is not being female. It's a clear pattern of reproductive symptoms plus stalled progress. Moving to slide 8. Sleep and stress are not soft factors on keto. They can fully determine whether you lose weight. Chronic sleep restriction can increase hunger signals, reduce impulse control, and shift how your body uses glucose. High stress can raise cortisol, which can increase water retention and drive cravings, even if you're low carb. A red flag is when the plateau comes with insomnia, waking up at 3 a.m. wired, or feeling tired but unable to rest. Another is a big increase in anxiety, irritability, or heart pounding, especially if you also cut calories aggressively. Some people interpret this as needing more discipline, but it can be your body pushing back. If you suspect sleep apnea, loud snoring, morning headaches, or daytime sleepiness, that's a clinician conversation, because treating sleep apnea often improves weight trajectories. The practical takeaway is simple. If your sleep is broken, your weight data becomes noisy. Fixing sleep is not optional troubleshooting. It's foundational health work. Moving to slide 9. Let's talk about medications, because they're a frequent reason keto weight loss stalls. Some prescriptions are associated with weight gain or fluid retention, including certain antidepressants, antipsychotics, steroids, some diabetes medications, and some blood pressure drugs. That doesn't mean they're bad or that you should stop them. It means your clinician should know your full list, including over-the-counter meds and supplements. Another issue is that keto changes hydration and electrolytes, and that can interact with diuretics or blood pressure treatment. If you notice new swelling, muscle cramps, unusual weakness, or heart palpitations after a medication change, that's worth discussing. Also mention recent antibiotics, because gut changes can affect digestion and appetite. The red flag is a plateau that starts right after a new medication, dose change, or injection schedule change. Bring dates, doses, and what you noticed. That makes the appointment far more productive and helps your clinician look for patterns rather than guessing. Moving to slide 10. Digestive red flags can also hide behind a keto stall. Constipation is common early on because fiber sources change and water shifts. Mild constipation is usually a troubleshooting issue, but if you have severe constipation, persistent diarrhea, blood in stool, black tarry stool, or ongoing abdominal pain, that's not a diet tweak problem, it's a clinician problem. Another concern is repeated nausea, vomiting, or an inability to keep food down. That can lead to dehydration and electrolyte imbalance. Also pay attention to reflux that suddenly worsens, because very high-fat meals can trigger symptoms in some people. Gallbladder issues can show up as right upper abdominal pain, especially after fatty meals, sometimes with nausea. If your plateau comes with digestive pain, don't assume it's detox or adaptation. A good clinical workup can rule out problems and help you choose a nutrition approach that your body tolerates. Weight loss is not worth ignoring warning signs from your gut. Moving to slide 11. If you're not losing weight, and you're also losing strength, hair, or energy, think about underfueling and nutrient gaps. Keto can be nutrient-dense, but it can also become repetitive. If your diet is mostly cheese, processed meats, and fat bombs, you may be missing key micronutrients and fiber. A red flag is persistent weakness, frequent muscle cramps, tingling sensations, or feeling lightheaded beyond the first adjustment week. Another is hair shedding that's dramatic and ongoing, especially if your calories dropped sharply or your protein is too low. Rapid restriction can also disrupt menstrual cycles and worsen sleep, which then feeds back into weight stalls. Clinicians may consider checking iron status, B12, vitamin D, and other labs based on symptoms and diet pattern. The takeaway is not that keto is bad, it's that any diet can become unbalanced. If your plateau comes with signs your body is running on empty, the right move is evaluation and a more sustainable nutrition structure. Moving to slide 12. Another overlooked reason for no loss is that your measurements are incomplete. The scale is sensitive to water, salt, inflammation, and bowel changes. If you started lifting weights, your muscles may store more glycogen in water, even on lower carbs, and soreness can increase water retention. That can hide fat loss for weeks. A smarter approach is to pair weight with waist measurement, how clothes fit, and a simple trend line over time. But here's the red flag twist. If your waist is increasing steadily, not fluctuating, and you're also getting more fatigued or short of breath with normal activity, that's worth discussing clinically. It could still be lifestyle, but it can also reflect metabolic changes, fluid issues, or other conditions. The point is to reduce false alarms and catch real ones. Use multiple data points and focus on trends, not single weigh-ins. That gives you a clearer signal for when a plateau is just noise versus a meaningful change in health. Moving to slide 13. So what should you actually bring to a clinician if you're worried? Bring a short timeline. When you started keto, your approximate carb target, and any major changes like intermittent fasting or intense exercise. Bring your weight trend, not just one number, and add waist measurements if you have them. List your typical day of eating, including drinks, sweeteners, and alcohol. Include sleep duration, stress level, and any new symptoms, even if they seem unrelated. Then bring a full medication and supplement list with recent changes and dates. This turns the visit from "I'm stuck" into a solvable puzzle. You can also ask focused questions like, are there labs that make sense based on my symptoms? Or, could fluid retention be playing a role? The goal is collaboration, not convincing. If your clinician doesn't support keto, you can still ask for help evaluating the red flags and finding a nutrition plan that meets your health needs. A good plan is one you can sustain safely. Moving to slide 14. Let's wrap this into a simple decision rule. If you're early in keto, feel okay, and your stall is under 4 weeks, it's usually normal. Focus on consistency, portions, protein, and sleep. If you're past 6 weeks with careful tracking and no change, it's reasonable to investigate deeper factors. And if you have red flag symptoms, rapid swelling, breathlessness, fainting, severe dizziness, persistent digestive pain, dramatic fatigue, or major cycle disruption, move the conversation to a clinician sooner rather than later. Keto can be a useful tool, but your health history still matters, and your symptoms are real data. If you want one next step, pick one category from this video and write down what applies to you. That becomes your starting point for a productive medical discussion. For a quick check-in, leave a comment with a forced choice. Is your biggest challenge on keto A, appetite and cravings, or B, fatigue and low energy? And if you want more evidence-based nutrition breakdowns like this, subscribe. This information is not a substitute for medical advice. Control insulin. Control your biology.